it's sort of very obvious, right? And it immediately marks that child out as different in some way from the rest of the kids, isn't it? Right? So there tends to be, possibly a certain amount of bullying, right? It usually is sort of an adjustment problem for the child when they first go to school with the eczema, right? Or if you look at an older age group, acne. Right? Now, acne in teenagers can have very disproportionate psychosocial impact. Okay, it's not even proportionate to the severity of the acne. The acne might be very mild, right? But the effect on the patient's self-confidence may be many times greater. Okay, it's not proportionate to the severity, right? And that's probably because young people tend to be more conscious of the acne. Yeah, they even did interesting studies where they found that patients with acne uh, tend to be less successful at a job interview. Okay, and that again doesn't correlate with the severity of the acne, right? It may be relatively mild acne, but it seems to sort of impact their performance at the job interview, equally as compared to those with more severe acne, right? So why should that be? Well, it's because it's the patient who's very conscious of it. It sort of impacts their confidence, right? Uh, or other patients with psoriasis, for example, we have patients with psoriasis, in the clinic sometimes, right? And they complain about how um, nobody wants to shake their hand in the office, okay, because all their colleagues are afraid that it's some sort of infectious disease, that it might get transmitted, okay? Or they might say, they enjoy swimming, but they find it difficult to go to the swimming pool because, they might have been asked to leave the swimming pool because of their skin lesions, okay, because people think it's infectious. Yeah, so there are all sorts of social issues which can come up, and it can be quite damaging for the patient's confidence, right? In one study, they found that patients with severe psoriasis, right, had sort of it had a very negative impact on their quality of life. They do these quality of life questionnaires where they try to measure the psychosocial impact of a particular disease on the patient's life. And in case of severe psoriasis, they were getting the same sort of scores on the quality of life questionnaires as with the patients who have heart failure. Okay, so it's having that sort of impact, psychosocial impact. Yeah, so although we tend to think of skin disease as being, well, it's just a skin disease. It's not, in most cases, it's not fatal, isn't it? Right? But for the patient, it's not quite like that. Okay? The problem with skin disease is that it's very visible, unlike, heart disease or liver disease. Yeah? So for the patient, it tends to have quite a significant social impact. Yeah? And we need to sort of we need to recognize that more, right? So as we go through, talking about different diseases, you'll find that there are actually specific tools, questionnaires, right, to assess the psychosocial impact of eczema, for example, on children, to assess the psychosocial impact of psoriasis. Okay, so we tend to take this into account as well when we're planning the treatment. Okay, this also has to be considered. Yeah? And in some cases, patients may even need counseling. Okay, think of vitiligo. Okay, so if you have young people with, especially young people with vitiligo, isn't it? If it's on a visible area, face, hands, and all, yeah, that also can have a disproportionate psychosocial impact. Yeah, so we need to sort of take these factors into account. So it's an important point, yeah, along with the other functions of the skin. Okay. Any other questions from the group? No, it looks like everybody's quite happy. Yes?
Yes, sir.
Okay, Alhamdulillah. Okay, well, we'll go back to the previous question that was about the hair follicle, right? What was it that you didn't understand, sister?
Regarding the lining of the hair follicle and its relationship with the skin surrounding.
Okay, basically, what happens with the hair follicle, right, is that it's lined by a few layers of cells, isn't it? And those cells are actually epidermal keratinocytes. You can trace, if you follow it up like in a histological section, if you follow that layer of cells up, it will be continuous with the epidermal cells outside the follicle. Okay, it's basically just a continuation of the epidermal cell layer. Okay, and in the bulb of the hair follicle, there is a specialized group of cells, right, which basically function as matrix cells. So they are the ones that synthesize the hair itself. Okay, but the lining cells around that, which continue up from the follicle through the duct of the follicle, they continue on to the surface as epidermal cells. It's just a continuation of the epidermis. Is that a bit more clear?
Yes, Doctor. Thank you.
Okay, that's good. Okay. Any other questions from the group? Okay, so thank you, Brother Fatul. That was very clearly presented, yeah, with a bit of humor also. Okay, thank you. So today, right, we've basically looked at, in the morning we talked about, how to take a history and do the physical examination. We talked about types of skin lesions and their arrangements and all. That was the clinical part, isn't it? And now in the afternoon, we've talked about the basic structure and the basic function of the skin. Yeah, so that gives us a bit of background. Yeah? So inshallah, we can build on this next week because I think I have all of you on Wednesdays, isn't it? Every Wednesday. Yeah. So inshallah, we can build on this next week by starting our discussion of diseases. Okay, the clinical features and the diagnosis, how to make a diagnosis, including investigations, and then importantly, the treatment also. Yeah. So I'm going to assign the topics for next week this evening, inshallah. So again, we'll have a few of the students presenting a selected topic, and open for discussion afterwards. And of course, it's always good if the rest of the group can also read up before the class, yeah, because then it becomes easier to understand, and also it will become easier to clear your doubts, isn't it? Because you've already identified which are the things you didn't understand. Yeah. So for next week, we'll be concentrating on eczema. Okay, we'll be starting on eczema. I'll post the actual specific topics and the presenters on the Google Classroom this evening, inshallah. Yeah. Okay. So if there are no questions, no further questions, I think we'll say thank you to the presenters. Yeah. Good job. Yeah. Is this the first time you're presenting seminar over the online? You've done this before in the psychiatry posting, or is the first time?
This block 3, this the first time.
For this block 3, it's the first time.
Yes.
You all have been doing online teaching for other blocks before this, is it?
Psychiatry, only psychiatric posting.
Oh, for psychiatry posting, I see. Okay, okay. So that's good. I think you all did very well, and I think it went quite smoothly. Yeah, Alhamdulillah. Yeah, and inshallah we will continue with the sessions next week, Wednesday. Yes. So if there are no questions, I think I'll let you go now. Yeah. Thank you to all the presenters once again. Good job, and thank you to all the other members of the group, yeah, for attending and participating. And inshallah, we'll see you next week. Yes. Thank you and salam alaikum.
Waalaikumsalam. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Thank you, guys. Thank you, Doctor.
Thank you, Doctor.